All right, guys, it's Dr. Truesdale. We're back at you. Today, we're going to talk about a very popular topic, fillers, everything you need to know about restoring volume in the face. Now, there are two main camps in terms of restoring volume in the face. It can either be done with fillers, dermal fillers, or with fat, okay, or autologous fat transfer. Let's talk about fat transfer first. When we're talking about restoring volume in the face, what we're talking about doing is enhancing contours, depressions, and changing the shape of the structure that's there, right? So I like to think of myself as an artist, and the face is my clay. And if you want to make a sculpture look different, you can either take that clay and remove clay, you can take clay and add it, or you could change what's there. When we're talking about filler, what we're really doing is we're adding clay to change the shape. So as we age, we lose volume in every aspect of our face, and it starts with the bone, the understructure, the skeleton. And as that skeleton starts to shift and change and resorb as we get older, you form depressions along different contours of the face. Now, in addition to the bone, there's volume loss at the soft tissue, in terms of the fat and the skin, as well as the muscle as we age. So by restoring that volume, it makes people look younger, more rejuvenated, and in a lot of ways can be just as powerful as a facelift. So let's break it down. Fat transfer is the first type of facial filler, okay? Fat transfer is a surgical procedure. It requires liposuction, or taking fat from another part of the body, processing it, and then injecting it or placing it into another portion. So we call the place where we take the fat the donor site. The donor site can be pretty much anywhere that's going to give us good, healthy fat. It can be from the arms, it can be from the thigh, it can be from the belly. Pretty much any place that you have fat, we can extract that fat and then inject it into the face. There are certain places that are better places to take the fat from. Typically, I love to steal the fat from the thigh or the belly. The thigh is usually my first choice because we can hide that incision, and a lot of times we don't need a lot of fat, so we're really not trying to make the thigh look that much different. So we take that fat and then we process it. We process it into little droplets of fat, anything from micro fat or even smaller sized particles of fat called nanofat. We then would inject it into the face to plump things up. Facial fat and dermal fillers can be injected in any place, anywhere in the face, forehead, neck, it can be injected, but certain places are better than others. So when we look at a facial skeleton, each face, each person is different. I might take that fat or that filler and inject the temple. I might inject their under eye. Sometimes I inject the brow or above the eyelid, the nasolabial fold, the under eye, the cheek, the earlobe, around the ear, neckline, the forehead, the upper lip, sometimes the chin, the pre-gel sulcus, the cheeks, all of these areas can be injected with fat. One bonus place that I often like to inject fat is the hands, because the face and the hands, no matter how much you work out, sometimes look deplete and show your age. So by adding fat to the hands, it really creates a nice plump area, and it camouflages those veins and tendons that give away age. So that's fat. Once fat is injected, then what happens is a new blood supply grows in to supply that fat. The benefit of this is that once that fat is there, it is alive and it is living in the face. Now, the downside of fat transfer is that it is more art than it is science. When we inject filler, we know exactly what we're putting in and exactly what we're getting out. With fat, each person will absorb a little bit of a different amount of fat. That means that we have to over-inject a little bit, knowing that some of that fat isn't going to all survive. So it requires a more artistic sculpting process. The other downside of fat, potential downside, is that if it is not done perfectly, right, if you inject too much fat, you have to surgically remove it. It's kind of a permanent process. So for that reason, I would like to underfill rather than overfill. You have to get the Goldilocks zone, not too little and not too much, just right. And so that's where the nuance and that's where the importance of having a seasoned person who performs fat transfer comes into play. Now, once that fat is there and it is alive, it's gonna be there and it's permanent. Unlike other fillers, dermal fillers, which really require multiple treatments, and over time you need more and more and more, fat transfer is relatively a permanent procedure. As long as that fat would have lived in other parts of your body, it will probably live that same amount of time in your face. Now, special considerations for fat transfer. Fat transfer is a living tissue, and so because of that, if it is overfilled, it is very difficult to get rid of. Meaning, if you have fat, and say I injected your face, and then you gained 60, 80 pounds, right? That fat would get larger, right? So it might look good when you're at your normal weight, but if you gain weight, that fat is actually gonna get larger the same way it would in your thigh or in your belly. So it's really important that when you're doing fat transfer, especially on young people, that you kind of take into account what might happen over time, because you don't want a jelly roll or little lumps or bumps in the future. That's fat transfer in a nutshell. Let's talk about the other big category. The other big category of filler or volume restoration in the face are dermal fillers. These are products like hyaluronic acid as one large category. The other large category are things like collagen. The other large category are things like calcium hydroxyapatite, or we have things like polyl-lactic acid. All of these things are different products or molecules that are bound together that we inject into the face. Let's talk about each one. Hyaluronic acid is a sugar protein, and this sugar protein is found in your skin. It's a normal thing in your body. Now, when we inject it, we're not using your own body's hyaluronic acid, we're using exogenous hyaluronic acid, which means that it's made in a lab. Typically, it's from basically the cell walls of bacteria. We basically make these bacteria divide, and then we extract the sugar protein. We bind them together in a certain chemical way to basically have different attributes. Those attributes determine how that molecule responds once it's injected. If we treat it and we bind it a lot, we can make that filler have more rigidity. It can be more cohesive, which means it's going to be more structural. Sometimes we want the filler to be a little bit more flowy or supple. Areas like the lip are great for this because when we speak, we want that area to be able to move and basically not form a lump. But other areas like the cheek or the chin, where we're simulating bone or volume loss at the bone, we want something that has a little bit more oomph. And so we might use something that has a higher G prime. It's one of the things that we say that determines the quality and the properties of filler. So when we're thinking about the quality and the properties of filler, a lot of that is determined by the molecular structure. How much water does the filler bind? All hyaluronic acid molecules bind water or H2O. And so when that happens, it creates that structure and it actually takes up even more volume. Some fillers bind more water than others. This is important because certain areas we want more plump. Some people want a very plump lip, and so you might use a filler that's very hydrophilic. Philic or lover means that it wants to love and it holds on to the water. So in other areas, we don't want a hydrophilic molecule like the under eye. And we have all seen people with under eye filler and it looks like big bags. That can be because of improper technique or because that water is there and it's binding to the molecule, looking like a big bag. So instead of it helping, it actually makes things look worse. So very important for your injector to understand all of the different nuances, qualities, and properties of each hyaluronic acid. And there are tons on the market. Juvederm, RHA products, we're talking about Restylane products. All of these are different types of hyaluronic acid. And in each category of hyaluronic acid, there are different brands and different sub-brands, okay? So there's Juvederm, and within Juvederm, there's Volux, there's Volor, there's Volbella, RHA, RHA 2, 3, 4, right? The list goes on. And it's not up to you to understand and know all of that, but your injector should be intimately aware and they should know this like the back of their hand, because if you use the wrong filler, it really can make a difference. Now, all fillers in terms of hyaluronic acid fillers are dissolvable, meaning if too much has been added, you can dissolve that with an enzyme called hyaluronidase. Hyaluronidase is a molecule that breaks up filler into water. And so that's really important for a safety perspective. If too much filler is placed, right, or God forbid that filler is injected into a blood vessel and causes issue in terms of blood supply, which can lead to necrosis, your injector can then bathe the area in hyaluronidase to dissolve that filler, or if too much is there, basically take it away. Then it can be restarted, or you can go to some other different technique to restore your volume. So that's an important consideration. Now, the other categories of dermal fillers, which are not fat transfer, are non-dissolvable. Things like collagen, things like polyl-lactic acid, things like calcium hydroxyapatite. These large categories are not dissolvable, meaning there's nothing that you can just inject into the face to make them go away. So the safety profile for those is a little bit lower, meaning it has to be done perfectly, because God forbid if one of those complications happen, you can't just make it go away. There are products on the market to inject collagen into the face. I do not use them and I don't recommend them, because when we have the face, we're not just thinking about collagen as some independent structure. Collagen is a framework. And so I like to think of the face as a natural, cohesive unit, and I'm trying to restore form and function that was there. Collagen just doesn't free float in your face. It's usually attached to the structure, a basement membrane of the cells. It's not just there as a clump. And so I don't inject collagen, one, because of the safety profile, but also I think the results can be a little lumpy and bumpy. Now, the other aspects of dermal fillers are things like polyl-lactic acid or Sculptra. Sculptra is a biostimulatory injection. And so what happens is that you usually need multiple injections, and it helps stimulate collagen and buildup of collagen over time. This is really good for some areas, like the temple, for example, when people have a lot of volume loss related to certain disease processes. You can add Sculptra and rebuild collagen. Now, the downside is it's not an immediate process. It usually takes multiple injections, and the time frame is more months rather than immediate. Hyaluronic acid fillers, fat transfer, collagen, immediately you see the difference. You can see that volume shift instantly. But Sculptra usually requires multiple sessions. The other downside of Sculptra is that it is also not a dissolvable type of filler. And so if you don't like it, you kind of have to just wait for those effects to wear off. In general, the non-permanent types of fillers like hyaluronic acid all have different amounts of time that they will last. And depending on the quality and the patient's own personal profile of how their body breaks down the filler, it will determine how long it lasts. Typically, most fillers last anywhere between 9 and 18 months, but there are some cases where it goes away even faster. And there are cases where it lasts for years and years and years. So it's a little bit unpredictable in that manner. Now, the last type of filler that I want to discuss is a calcium hydroxyapatite type of filler, also known as Radiance. These are basically little microspheres of calcium that your body integrates, and it helps build up over time. Now, just like Sculptra, this type of filler requires usually multiple treatments and is not just a very quick done procedure where what you inject is what you get. It's usually a little bit more of a stimulatory process, and it takes multiple times, multiple sessions to get there. But it can, in the right hands, the right injector's hands, it can be a very powerful type of filler that can be great for you. We've talked about a lot. Now, to review, we've talked about dermal restoration or volume restoration, everything from fat transfer to fillers. In the filler category, we've talked about hyaluronic acid fillers, we've talked about polyl-lactic acid, we've talked about collagen, we've talked about hydroxyapatite, and all the different brands under there. To come home, we have to say that each face is like a snowflake. And so it determines what choice to choose based off of the face that's in front of you and what the goal is of the patient. If you want something that is one and done, there is nothing that is necessarily one and done outside of fat transfer because it's relatively permanent. If you want something that is reversible, then you might want to go with something like a hyaluronic acid filler. If you want something that is a little bit more biostimulatory, you might want something like Sculptra. So each patient, in terms of their goals, it really determines what choices that the surgeon should make. Within those choices, it's up to the surgeon or the injector to be familiar with the qualities and the safety profile of each injection, because each injection or product has a different benefit and drawback, and each part of the face requires a different injection technique and product. So I hope you all learned something. I can go on and on and on about this, but this is a primer or introduction to restoration of volume in the face.